We have 14,283 confirmed cases, cumulative cases of coronavirus in Victoria. That's 466 new cases since our last update. I'm saddened to have to report that there are now 193 Victorians who have passed away because of this global pandemic. That is 12 further deaths since yesterday. One male in their 30s, two males in their 70s, two males and three females in their 80s, and four females in their 90s. Again, we send our best wishes, our condolences, our sympathies to those families, and we acknowledge that this will be a very difficult time for them. They're in our thoughts and prayers. 6 of those deaths can be linked and are associated with aged care settings. There are 636 Victorians who are in hospital. 44 of those are receiving intensive care, and 29 of those 44 are on ventilators. There are 2,584 cases with an unknown source. That's the aggregate number. It's an increase of 130 since yesterday. Those mystery cases, 130 since yesterday. And again, that doesn't relate to yesterday's data. It'll be the cumulative work that's done by our coronavirus detectives over several days. That's the latest update of cases where the circumstance and the person who are essential to that infection simply cannot be known. There are 29,783 tests were processed yesterday, a significant number. Very grateful to all of those coming forward and getting tested, and of course to the large team of people in laboratories who are doing that work. That brings the total number of tests. As I said, these numbers would lag for a couple of days while we were exclusively focused on positives rather than tallying up all the negatives, but every few days I'll be able to give you this more detailed number. That's 1,759,969 tests, with, as I said, 29,783 which have been processed in the last 24 hours. We have currently 998 healthcare workers who are active cases. That's an increase of about 140 since yesterday. And the total number of active cases across the state is 7,808. Just finally, in terms of additional information that I needed to go to before I make a couple of general comments, there are, and again there'll be some that are being investigated, but in broad terms, just under 7,100 cases in Metro Melbourne under stage 4, and just over 500 cases in regional local government areas under stage 3. So that's two very different sets of circumstances. Those settings are important though, with 500 plus cases in regional Victoria. It's very important that we move to that stage 3. We know that's deeply inconvenient, very challenging, but we need to do everything we can to keep those numbers low. That is what drives our policy decision and the move to stage 3. And I understand there are some communities who, I think their sense of frustration at seemingly being COVID-free and yet having these sorts of restrictions. I can appreciate that. But at the same time, with the number of mystery cases that we have across the state, and indeed some in regional Victoria, we have to assume that there is more virus, more transmission, more cases out there than the data tells us. That abundance of caution is critically important to get to the other side of this as a whole state, and not necessarily have a situation where there might be reductions in Melbourne but see increased numbers in regional Victoria. We don't want to have that happen. Beyond that, I don't have any other numbers to share with you as part of the daily update, but I would just take this opportunity again to thank all those Victorians, Melburnians and Victorians across the whole state who are taking this seriously. They're playing their part, they're doing the right thing in following the rules, making decisions that are not just based on their safety and the safety of their family, but the safety of every single family. And that's not just the right thing to do, it's the smart thing to do, because Victoria Police are out there in significant numbers and they have an absolute determination to enforce these rules, because this is the greatest challenge we've ever faced. And if we have even very small numbers of Victorians doing the wrong thing, that can undermine the entire strategy. I do hope to be able to give you some further enforcement data tomorrow, and we may even have somebody from Victoria Police come along and be able to support us in talking about some of those infringements that have been issued. But I think the data, certainly from ADF door knocking, I made this point yesterday, but just I'll briefly go to it again, to have done 1,150 door knocks in a day, biggest single day's effort. That's health department officials and ADF staff, and to have 1,000 of those people found where they should be. That shows you, I think, that the percentage of people who are doing the wrong thing is coming down. That means that more and more Victorians are doing the right thing, and that's critically important to making sure this strategy works. Can I just, before I ask Brett to add any comments he wants to make, and then of course we'll take any questions you have, I just want to thank all of those partners across the board, industries large and small, metro and regional. There have been literally thousands and thousands of discussions, round tables, Zoom meetings, phone calls. It's been a massive task, and it'll be an ongoing one in many senses. I've just been talking with the person in my office who's been coordinating that, and there's a lot of positive feedback from many different businesses across the state who, whilst not happy to have to make these changes, of course they're not happy, neither am I, to have to make these incredibly difficult decisions. I think that the way we've worked together so closely has made a really challenging set of circumstances just a little easier. Not easy, but a little bit easier. But we know there's a lot of pain and hurt, and there's a lot of challenges that each of us are dealing with, and industry is certainly at the centre of that. But that engagement, that very deep engagement, I just want to make it very clear for all Victorians, that doesn't end. There will continue to be refinements, there'll continue to be consequences that couldn't reasonably be foreseen, and that dialogue, I think, will serve us well as we continually craft a set of rules that achieve our outcome, dramatically limiting movement to then dramatically limit the number of positive coronavirus cases, but at the same time making sure that there is product on the supermarket shelf, and that as much economic activity that simply can't be halted can continue in the safest possible way. That's the other thing we haven't talked a lot about, and they're the very detailed and very strict coronavirus, or I should say COVID-safe plans that have been put in to each of those industries. We'll have more to say about the enforcement of those plans, but industry well know what they have to do. We're supporting them to do that, and we're very grateful for the cooperative and really important dialogue and the many, many discussions that we've had and will continue to have to make the best of these incredibly challenging circumstances. There is no alternative. If there were, then of course we would pursue that, but we've got to drive down movement, to drive down cases, to get to the other side of this. Just finally, we had some discussion yesterday and indeed the day before about individual daily numbers, and whilst we'd always like to see less cases rather than more, I think the important point here is that the effect of many of the stage 4 changes it's only days old, some of which are not even in place yet, given that there were some extensions granted for the best of reasons to a number of settings until midnight tomorrow night. So we're not going to start to see impacts of these measures for a little while. The important thing here is to acknowledge that it's a massive team working incredibly hard. I think Victoria and Victorians are equal to this challenge, even despite the fact that it's perhaps the greatest challenge we have ever faced. But if we stick together, if we look out for each other, if we make good choices for our family and every family, then we will get to the other side of this. None of this is easy, none of it is pleasant, but it is the only way that we will bring these case numbers down. And that's got to be the singular focus, and it is my singular focus and the focus of the government and the massive team of people who are working night and day. And I would congratulate and thank all those Victorians who are similarly focused, and to anybody who isn't, I would just again appeal to you, do the right thing and do the smart thing. Victoria Police are out there and you'll get a pretty hefty fine if you're not, and there's just no other way for us to bring these numbers down. I might now ask the Chief Health Officer to make a few comments, and then we're happy to take any questions you have.
Thanks, Premier. Yeah, certainly we're seeing some stabilisation in numbers. We've got 400 to 500 cases each day. That has been more or less the average for the last week. That's not good enough, but it is a positive that we've averted an exponential increase through the last couple of weeks. If we hadn't stabilised these numbers, we would have seen thousands of cases per day, and there are estimates we've averted 20,000 or more cases by virtue of the stage 3 restrictions. But as I say, that hasn't been enough. That's been able to stabilise the numbers, but we cannot have 500 cases every single day and the associated morbidity, hospitalisation, intensive care requirements and deaths that are associated with that number every day. Stage 4 restrictions will make a difference, but we won't see them for another week or more. But we can drive numbers down, and we will drive numbers down. The ongoing challenges will be in the outbreak settings. We know that aged care is particularly vulnerable. We've got over 1,600 active cases in aged care at the moment. Our healthcare settings are another area where we absolutely have to make sure that we can protect everyone in those settings. The other outbreak settings are our high-risk industries, and I spoke yesterday about disability settings. Even though the numbers there are significantly less than in aged care, it needs the same coordinated and rapid response. There is a rapid response outbreak unit that coordinates in the same way the emergency management operations, the Commonwealth and state responsibility to manage cases in those settings. But across all of those outbreak settings, we really need both a prevention, a rapid response, and then as community cases are driven down and there's less introduction of virus into those settings, we really need to make sure that they are protected from any further cases. If they become COVID-free, if those outbreaks are ended, then we absolutely have to make sure that they remain COVID-free. That will require all of the things that we're trying to get in place now, but some real vigilance and with a particular focus on staff and the very first symptoms that they might develop, and to make sure that they're isolating at the very first instance. But it's all of those elements, including the personal protective equipment, the training and the rapid response that needs to be in place.
Shortage of PPE in their workplaces. Is that good enough, and what can be done to help them?
I might have the Premier speak to that. My understanding is there is no statewide shortage of PPE. There is no bottleneck in terms of distribution to any healthcare facility and to healthcare workers as is required. So there's certainly no lack of PPE in order to protect those healthcare workers. But I'll get the Premier to speak to it.
Thanks, Jody. We have in our PPE warehouse at the moment, we have 68 million gloves, 19 million surgical masks, 2 million face shields, and 530,000 goggles. They're all in the warehouse at the moment. They're being distributed each day. We receive shipments coming to us, perhaps not every day, but certainly each week. There are adequate supplies of PPE. But what I'm going to do, in fact what I've done this morning following the survey that the college has put out, I've asked health department officials and indeed those who are responsible for our hospitals to meet with the college and to better understand that survey, that data, and if there's any improvements that we need to make, then of course we would stand ready to do that. I want to give a shout out not just to our nurses, they're doing an amazing job, all the team across our health system. This is an anxious time. This is a very challenging time. We've got the supplies. I also wanted to give a shout out to those who've worked incredibly hard to get these masks and gowns and goggles and face shields, gloves, the whole kit. Everybody in the world is after this at the same time. That always makes it very challenging, but the team's done a mighty job to have what we need. I can also confirm that just last night, colleagues and I, yesterday afternoon I should say, we approved a whole lot of additional orders, N95 masks, all sorts of other masks and gowns and gloves, particularly in relation to some of those industry settings where we're really upping the kind of PPE that they have to wear. So I think the best thing is just to be really clear. There are adequate stocks. There's an enormous amount of work has gone on to get that PPE that's sitting in the warehouse. But we will sit down and talk with the college about their survey and about the results. But I do want to acknowledge that for nurses and indeed the whole health team, this is an anxious time. That's why we've got these stockpiles, and that's why we are distributing them literally each day.
Where is that disconnect coming from, Premier? On the one hand, they say they're waiting. On the other, you say that there is enough.
Well, it's not a matter of it is a matter of fact. We have all of those stockpiles and more, and the fact that we're receiving so many orders each week, those numbers will only increase. But we do know we have a significant challenge in the amount that is needed. What I want to do is to better understand the results of that survey, and if there's any improvements, any changes that need to be made, then of course we would stand ready to do that, and we would waste no time doing that.
Premier, today there are claims that as part of the hotel quarantine process, security guards were hired in an attempt to offer jobs under a social inclusion policy. Could you shed any light on whether that is true, and if so, why?
I don't intend to be running a commentary on these matters. There is a separate process to deal with those matters. I don't believe those reports are accurate, but in any event, that's not a matter for me to sit in judgment of. I think the most important thing is for the separate process that's well at arm's length from government to run its course, and as I think we all know, that work has well and truly started. There's more than 100,000 pages of documents, and Judge Coate is working through those. That's entirely a matter for her.
That separate process, Judge Coate herself has said that separate process is available and open for you to comment on. Are you still not willing to do that?
It's not a matter of being willing or otherwise. There are many questions for which I don't have the answers. I have set up a process to get those answers. I'm not going to sit in judgment of myself. That needs to be at arm's length. It needs to be independent. That's why it has a budget, broad terms of reference, and a person chairing it who has a lifetime's worth of experience, and I think the skills needed to get us the answers that we're all fundamentally entitled to.
That same report says that the department that was part of making the decision about using contractors for hotel quarantine is the Department of Jobs, Precincts and Regions, and also Global Victoria was involved in that, neither of which are health-focused, infection control-focused. Were they in charge of this process?
Well, the lines of command, control, the adequacy or otherwise of any arrangements put in place, they are matters for the judicial inquiry to work through without fear or favour, at arm's length from government, and then provide us with findings. They'll come to us, and then we'll be able to have a much more detailed discussion at that time. Again, there are many questions that need answers. That's exactly why the process has been set up. And as I said the other day, I will freely concede I've not read 100,000 pages worth of information on this. I simply do not have time to do that. The program has been cancelled for the purposes of returning overseas travellers. There are still some people, for one reason or another, that are in quarantine and are being supported by us. The key point there is that entire program has been reset. Department of Justice, Corrections Victoria, and where appropriate, Victoria Police play a role now. Corrections Victoria, in fact, lead that program. Yesterday, National Cabinet went through a whole range of different issues in terms of caps for returning Aussies. And again, it was noted by National Cabinet, and I would hope be noted by the broader community as well, that in Victoria, that program is not running, and it will not run until we are completely satisfied that we are dealing with this second wave, and that we've got the sort of capacity that would be needed to again have overseas travellers coming back, not all of whom are actually Victorians. We will need to get past the current challenges we face before we see those flights come back here.
Has any public servant been stood aside or moved on from their role because of their involvement in this process?
Again, these matters are appropriately dealt with via the process that I have set up and that I have referred to. Again, the program is not running. That's a difficult decision to make, but the appropriate decision.
Are you worried that leaks like this are coming out of your government? Are you concerned that it's taking away from the message that you're trying to focus on about the virus?
No, I don't think so at all. I think Victorians know and understand what they have to do. I think Victorians know and understand that this is a very big challenge, and the only way we will get to the other side of this second wave is to drive down movement across the Victorian community, then drive down case numbers. That'll get us to the other side, and then we'll be able to begin the very long and challenging process of repairing the damage to the economy that simply had to be done to deal with the health challenge. That'll be a long process, but it'll be one that we will work very hard in partnership with many to make sure we deliver the very best outcomes possible.
Are you concerned by the fact that the media seems to be unveiling more about the scheme than you say that you know about how it was run?
Those matters are of no concern to me whatsoever. I am focused on dealing with this virus 24/7 or pretty close to it. That's what I'm doing. And you've got a job to do. You can write articles as you see fit. That is not something that takes up very much of my time. With the greatest of respect, I'm sure you would appreciate that I have many other things that I need to be focused on. That's the job I have. Judge Coate has a different job. She's been given those tasks because I think she's the appropriate person to do that important work.
Can you just make it clear to Victorians, though, do you not know these answers or you won't give these answers publicly?
No, I've already dealt with that issue. I dealt with it at length. I think it was I'm not quite sure of the exact minute count, but it was a pretty long press conference where I went exactly to those issues. There are many questions that I simply don't have answers to, and I want that clarity. I want that certainty about what happened, and that's exactly why the process has been set up. That answer is no different in any way to the answer I have provided for weeks and months now. The judicial inquiry is very important, but it's not about me marking my own work or sitting in judgment on myself and my colleagues. I think that should be rightly done at arm's length. That's exactly what's happening. That is the right way to deal with these issues. And of course, whilst that process is occurring led by others at arm's length from those who need to be exclusively focused on driving these numbers down, I think we are better placed to achieve that aim.
Premier, can I ask about childcare? There's
Sure.
been a lot of confusion and stress among parents in the last few days. There's been some revisions from the government. What do you think the government could have done better in the last few days in managing childcare?
Can I just make the point? How you want to describe changes, that's entirely a matter for you. I've been really clear about this. This has never been done before. It could not be made perfect. It is impossible. I'd rather be criticised for having made changes to this scheme to try and find those very difficult balance points than to have simply said, no, these rules are chiselled in stone and I won't budge on them. That's not what we're doing at all. And we flagged, going right back to Sunday last week, that given the fact this is unique, given the fact that it's never been done before, there is no manual to follow here, that there would be a need for refinement and some changes. And they run from childcare, they run to warehousing, pharmaceutical industry, medical device industry, beef processing and poultry processing and everything in between. This is where we find ourselves. It can't be made perfect, and I think an open door policy, a proper approach to these things where you listen and make the modifications and changes that are the most appropriate to find that balance. I think that's a far preferable way than saying to people, no, this is a binary thing and we won't budge. On childcare, if you are a permitted worker, if you have no one else in the home, you can attest to the fact that no one else can look after your child, then your child can go to childcare. I know that is very challenging for a number of families, many families. But I would just ask Victorians to appreciate that if we don't drive down movement, if we have anywhere near the normal number of people moving around Melbourne, whether it be going to work, to school, to childcare, to kinder, and everything else in between, we just won't drive these numbers down. And I'll take you right back to where we started on last Sunday, that if we continued with stage 3, if we didn't make these heartbreaking and incredibly challenging decisions, then it wouldn't be a 6-week strategy. We'd be pretty well close to Christmas, and we would still be seeing hundreds and hundreds of cases each day, because with a R0 number at about 1, that's every positive person infecting another person, then the numbers don't come down. You've got to get to a situation where every second or every third positive person infects somebody else. That's how you halve and then halve again and see those numbers fall. So it's very difficult, and I truly appreciate that this will be very, very challenging for a lot of families, but we've tried to strike the best balance to achieve our objective, one that we all share in. We all share in the benefits of that, but at the same time not to have people who are doing permitted work, and particularly those who are part of the response to this virus, we didn't want their ability to make that contribution for all of us. We didn't want that compromised by them not having childcare.
The man we've lost, who was aged in his 30s, was he a healthcare worker, and do you know if he had any underlying health conditions?
He was not a health worker. I can confirm that. Beyond that, though, I'm not in a position to be able to confirm anything other than his gender and his age range. If we can, following discussions with his family, provide you with more detail, of course we will.
Can I ask what the reproductive rate is, or the R number?
The effective reproduction number's likely to be under 1, certainly in the 0.9 kind of range. But these are modelled estimates, and they're a best guess. They work on assumptions that go into the model, but they're also updated on a twice weekly basis with the numbers that we're seeing each day. So it's both an assumption around the movements that we're seeing across Melbourne, across Victoria, but also following the numbers each day to try and see if that effective reproduction number estimate is validated by the numbers we're getting every day. So I think we're headed in the right direction. That 0.9 really needs to be at 0.5. I think stage 4 restrictions will head us in that direction. How far we can get there is a matter for all of us as community members and our behaviours, because it does relate not just to the work settings that are obviously constrained in stage 4, but all of our individual interactions with everyone around us, including our family members, including our workmates. So it's one thing to be a permitted worker, but it's another thing about doing the right thing when you're at that workplace. And so that effective reproduction number will also be altered by how many people stay home when they're unwell, how long it is from the very first symptoms that you get until you isolate. If that is 3 days for some people now, we're not going to get to an effective R naught of 0.5. We need people to isolate from the moment they get those first symptoms, the scratchy throat, the runny nose, the beginnings of a cough, the very beginnings of a fever. That's also part of the equation in terms of getting transmission down.
We're looking at an aged care centre today that doesn't have any confirmed cases of COVID, but has invited its staff to actually move in and live on site to limit their interactions in the community and hopefully limit the spread if a case does occur. Is that the kind of innovation that you're looking at businesses implementing to try and help combat this?
Yeah, I think we need to look at every innovation, absolutely. There are lessons out of Europe, out of North America, but especially out of Europe. And some of those were about the fact that you don't move people into acute care settings. I know there's been a lot of discussion around, some imperative to move all positive cases out. But it's clear that there are innovations that relate to how you surge the workforce in an aged care facility to manage positive cases and to manage the close contacts, to manage all of the other residents in those settings. And having staff on site is absolutely an innovation to the extent that it limits their interaction with other community members. We know that a number of aged care workers are picking up that virus in the community. And so the extent to which that interaction can be limited is absolutely a positive thing.
How and when do you start measuring the effectiveness of mandatory masks? When do you expect to see that in the figures?
Look, it's a bit tricky to know exactly how the effect of mandatory masks will be seen. There have been other interventions. The curfews come in through that period. Other changes in our mobility has occurred during that period. But there will be academics who will no doubt try and tease out those other factors to see the effect. There are some estimates that it can reduce the effective reproduction number by about 15%. If that's happened in Victoria, that would be absolutely a good thing. That's many more thousands of cases over the forward period that have been averted. One of my concerns, it's clear that people have taken up masks really, really well. One of my concerns is it happening in the settings, with the people, and at the times that it's most required? So again, you can see lots of people wearing masks in lots of settings, but are people in the workplace, in high-risk transmission areas, at all times wearing those masks? Or are they taking masks off at tea time, at a break period, and then sitting very close to workmates. So the numbers will let us make some estimates about how well masks have been used, but it is a critical thing that it's a universal, all-time, all settings recommendation.
There have been some suggestions out of the EU that it will take at least 4 weeks to see numbers drop. Is that a more realistic time frame than the fortnight?
No, I think we'll see numbers drop before then. I think, you know, the very dramatic reductions that you can already see in traffic, foot traffic, road traffic in Melbourne in particular, is an indication that there's been a significant shift already. Of course, there's going to be a shift. There are workplaces that are closing. There are many others that have scaled back, and there are very clear directives about working from home if you can work from home. All of those things will make a difference. And I think even though there were policy settings that everyone who could work from home should work from home, there was probably more traffic on the roads that indicated that not everyone was doing that when they absolutely could. I think the great majority were, but we can go further, and I think that's in place now, and I think we'll see the effect of that in the next 1 to 2 weeks.
Is there any evidence to suggest that Melbourne is battling a mutated or more infectious strain of the virus?
No, I don't think there's any evidence that we've got a tougher virus in terms of its transmissibility or its severity. We do have the challenge that the world has of second waves, the behavioural fatigue, the ability to penetrate with the message, the ability for people to sustain those behaviours over such a difficult and long period of time. That's why Israel's second wave is 4 times bigger than its first. That's why Spain's already looking at a second wave that's almost as substantial as its first. That's why Iran never really moved through its second wave. They couldn't get those changes to come into place. We're working so hard to make sure that we can shift those behaviours and make the structural differences that limit the interactions that people have so that we can get through it.
Those mystery cases went up 130 today. While the overall number seems to be going down, that seems to be sticking around. How worried are you by that, and why is that still happening now?
So they're the mystery cases that have been resolved today. They're the ones that have been finalised for each of those cases. But tracking the proportion of community cases or mystery cases as a percentage of the total over the last month has had some positive signs. We've seen a proportion at about 16-17% early in July. It increased up to 26-27%, and then it's come back down, and it's probably sitting, if you look at each day, sitting at around 17 or 18% again now. So the numbers that we get each day are the numbers that get finalised in the data. They're not the day's figures.
Healthcare workers, it seemed like there was a bit of a jump there today. Is that driven by any particular settings or?
Well, we do know that healthcare workers are affected across all settings, but there is a significant proportion that are support ancillary workers in healthcare settings. Nurses make up a bigger proportion than doctors. And aged care workers make up another significant proportion. So it is a spread. It's all concerning, but the response is, not dissimilar across the board. We have to make sure that people get the PPE that they need, that they're using it appropriately, and that the first signs and symptoms of coronavirus means that those individuals are isolating, that their close contacts are quarantining, they're getting tested, and they're getting those results back quickly so that their close contacts can be followed up appropriately as well.
On contact tracing, I know you say that people get contact within 24 hours, but it seems like that's not actually tracing the contacts. We get reports that it's a week, up to a longer. How kind of concerning is that, and does that kind of, in the same way that people were breaching restrictions, if people aren't getting their contacts traced, does that kind of just null and void any impact that the restrictions might be having anyway?
No, the restrictions will have a significant impact regardless, but it's not a substitute for contact tracing. They need to work in concert. And we know that when we've got over 7,000 active cases, that the contact tracing surge is really challenging. But we also know that there are countries in the world, jurisdictions of similar size or much larger than Victoria, that stopped contact tracing at 50 cases a week. We are at 2,500 cases a week, where we're still doing contact tracing. But the system gets stretched in terms of the time to get swabs to labs, for labs to process them, for all of that data to come into our database, and for all of our interviewers to do the interviews and the contact trace details to go in, and then automate that message to all of those close contacts. That pushes out the total time more than I would like, but it's a measure of the scale of cases that we're getting every day and that we need to follow up. When we start to drive down cases, that will be more and more efficient, and people will be contacted even earlier. I've heard that there are moves for individuals to be aware of their status as soon as they hear their own result, and to follow up with their close contacts. That is not a bad thing. I would also encourage those individuals, if they're confident and comfortable in doing so, to let their close contacts know that they need to quarantine, so stay away from others until they can get the formal notification and be followed up.
Our limit is on weekly or daily numbers in terms of being able to keep the contact tracing going?
I don't think we're close to limits. We've got spare capacity in the interviews that are done for all of our cases. We could double that and still do it comfortably, but we don't want to get there. Again, the total number of positive cases just increases the opportunity for transmission. It increases the length of time for labs to process swabs. So it's not a question of meeting our contact tracing capacity. We just need the numbers down for all of the reasons that relate to people's health and well-being.
Any capacity constraints for hospitals receiving patients at the moment, or how is it spread?
Look, I think individual hospitals can struggle sometimes, depending on which workforces are affected. But I've not received reports that there are any critical shortages that are requiring, an emergency intervention.
Can I ask the Premier a question? Yeah. Sure.
Greyhound racing was continued because of an animal welfare issue, but places like the Lost Dogs Home and the RSPCA aren't able to have people in to adopt dogs, and you also can't go and pick up your pet if it escapes and is taken there. Is that an unintended consequence of this stage 4?
No, I think that it's about limiting movement as much as we can. And of course, some of those codes, the 3 codes, were operating under very strict rules, very strict biosecurity rules. They've even been tightened further. So, for instance, apart from those who are connected with the broadcast, there are no journalists that would normally cover those codes. They're not on track. I think owners have been paired right back as well. I'm happy to get some further advice on lost dogs homes and things of that nature, but again, it's not surprising that we would see some things that can continue but under different rules, and some things that were permitted will have to end if we didn't make that decision. And again, I go back to the point I've made a few times, and I understand how challenging and difficult this is. They're not easy decisions to make, but they are the advice, and they are the only way forward. If I were to say yes to every well-argued case about, well, I'm a low-risk setting, why can't I keep going, then I'd in fact have more people at work and more movement in August than I had last month. And we simply can't have that, because that'll just mean more virus rather than less. On the specifics, I'm happy to chase that up, but it's not surprising to me that there are a number of settings where that they've had to make massive changes in how they work and the number of people that move in and out, and the contribution that they make to general movement, and the amount of person-to-person contact that we have right across metropolitan Melbourne. If we don't do that, then we simply have no chance whatsoever, like zero chance, of driving those numbers down.
Premier, can I ask, why is the safe injecting room in Richmond able to stay open until 9 o'clock, at least an hour after curfew?
Well, they will operate as close to their normal hours as possible, no different to a hospital emergency department, no different to any other provider of healthcare. The notion of changing those arrangements and effectively seeing less people able to access the care and support that they receive at that dedicated facility, well, that will mean we go back to the sort of intolerable circumstances that saw us establish the supervised injecting facility, and that was dozens and dozens of people dying alone in laneways. I don't think that would be a very good outcome.
ask on movement, you were saying you're trying to push movement down. Childcare operators are saying that with the new kind of looser rules, they're probably going to go from, say, 1 in 10 kids coming in to 5 in 10. It's a pretty significant increase. Is that just, are you okay with that increase?
Well, it's about trying to find a balance. And I'll take you back to the point I made earlier. This is about listening, and it's also about trying to be as fair as you can be. They're very difficult decisions, and we certainly are not going to apologise for having made some changes to try and get to the other side of this. The important thing here is to take that feedback and then make whatever changes you can without undermining the overall objective. So I'm not sure about those estimates. That every childcare centre is different, I suppose, in terms of the percentage of their total parent group that are working in given industries. I think it's quite difficult to compare one childcare centre in one part of Melbourne to a childcare centre on the other side of town. They're all quite different. But we believe that these arrangements will still leave us with an acceptable reduction, a necessary decrease in the amount of movement. And even at that number, and I don't know that that will be the number, I think it'll be less than that, in terms of numbers of kids going. Even at that number, this is very, very challenging for a lot of families. And if there was another way, then of course we would do that. There simply isn't.
Do you have an idea on that number, Premier?
No, I think there's. I'm more than happy to try and come back to you. Again, it will vary. I think for instance, we had I know a couple of days ago there were quite a few reports of childcare centres that didn't have anybody. There was no children had been dropped off, and that may not be quite 100% versus zero, but I think there's a lot of differences. There's a lot of variance in terms of each and every childcare centre, kinder, and indeed we saw a bit of that in schools as well, when schools were open under different circumstances earlier for the supervised remote and flexible learning, where learning from home was not possible. We saw some schools that had very, very small numbers and other schools that had more, and that was in many respects a function of different arrangements, different industries, all of those things. As soon as we can get a better sense of that, we will. And that's rather than, I suppose, trying to do the estimates. We will see as we move through another working week next week. We'll see actuals, and if we can keep you updated on that, we will.
Parents that are still stressed and confused today, what's your advice to them on what they should do to try and...
Well, I think we've tried to push out the details of what's allowed and what isn't. We'll be grateful. Obviously, all of us are in this together, and if you can play a part in getting that information out, then of course that'd be a good thing. I think that for many people this will be welcome news, but for others, of course, it's very, very challenging, and I know that. And I want to make it clear to those parents that we fully acknowledge how difficult this will be, but there's just no choice. Again, I'll make the point. We have zero chance of driving these numbers down if we don't drive movement down. The amount of person-to-person contact, the amount of people that are moving throughout the community. This thing is, as I've said before, it is a public health bushfire, but you cannot smell the smoke and you cannot see the flames. It moves so fast that unless you make these changes, we just have no chance whatsoever in driving down these numbers. The good thing, though, is because we are making these decisions, as painful, as difficult as they are, our experts tell us, and logic tells you, that we will see a reduction in numbers because there's that reduction in movement. Now, everyone has to play their part in that, and that's why I'm so grateful to everybody who is. And it seems to me, from traffic data, from some of the enforcement data that we've had, it's not a complete data set yet, but from some of the enforcement data that's come forward to us, there is a growing number of Victorians, a higher percentage of Victorians who are doing the right thing, and that's impressive and really, really important.
The federal government is pressuring states and territories to contribute more money to the economic response. Do you think that's fair? And given here in Victoria we are requiring the most support at the moment, have we been contributing enough to that?
I wouldn't describe the Commonwealth Government's approach in those terms. I think that the Prime Minister has been very clear with me, and I've been very clear with him, that this is a challenge that we both must face together, and we have to work together closely. And that's in terms of the kind of operational response to the virus right now, and that principle will be true and very important once we get to the other side of this second wave. This is a challenge that is best met by everybody, regardless of political party, regardless of level of government. You know, premiers and prime ministers alike have to work closely together, and that's exactly what we're doing.
Some members of the federal government are blaming Victoria's quarantine failures for the increasing cost to the budget. Do you feel in any way responsible for that rising cost?
I'm not going to respond to unnamed, alleged federal members of parliament. Again, I haven't got time for those sort of silly political games. We've set up a process. We are focused on what we need to be focused on, and that is working together, all of us, to get this job done. That's what I do, and this is no different.
Workers prove they need access to childcare. Are you simply taking them at their word?
There's a permit system. They have to attest that firstly, as a matter of fact, they are a permitted worker, and that they have no other arrangements that they can put in place. There's no other adult in their home that can provide that childcare. Again, I just say to people, there is a sense of trust there. There are penalties, though, if you made a declaration that was false. I would hope it doesn't come to that, and I'd be certain that it won't. Unless everybody takes this seriously, changes and modifies the way all of us are doing that, we've all got to keep doing that for another 6 weeks, and if we don't, then we simply won't see these numbers come down.
Police said today there was about 200 fines for breaking the CHO's direction, 62 people breaking curfew,
Yes.
People with excuses like they're on a train away from home to get some fresh air. What do you make of those numbers coming out, and what do you make of how people are...
Well, every one of those breaches can potentially trigger a chain of transmission that can finish up with hundreds and hundreds of people infected. That's the key point here. I've used that bushfire analogy a few times. It's like, you know, it's spot fires that can finish up an absolute inferno. So people need to do the right thing. Police are out there, they're not mucking about. They've got extra powers, they've got extra penalties, and they've got the absolute determination to enforce these rules. And again, I just say to people, every one of these fines can be avoided. 100% they can be avoided. Don't make those selfish choices. Don't think that somehow you're entitled to do things that no one else is allowed to do. It's a very simple thing. So whilst every one of those breaches is potentially a big problem for us, I think in aggregate, I wouldn't want the behaviour of those individuals to take away from the fact that the vast majority, and I think a growing number of people across Melbourne and across Victoria are doing the right thing. They want this to be over. They want to get to the other side of this, and I think the vast majority, to whom I'm very, very grateful, I think they appreciate and they understand that unless we do these things, unless we make these changes as hard as they are, we just won't get these numbers down. We just won't get to the other side of this.
Have any of those larger fines for subsequent breaches?
There have been a number. I haven't got an exact tally, but I think there's certainly more than 2 or 3. But again, hopefully tomorrow I can have that tallied up for you and give you a more detailed breakdown.
37, 38. I have actually lost count of how many days you've stood here and delivered a press conference.
I'm not entirely sure either.
Yeah. Simple question from me. How are you?
Oh, look, this is not about how I'm feeling. As I said yesterday, this virus doesn't stop. Neither do I. Neither does the team I lead. There's thousands of people working on this 24/7. And all I'd say to Victorians is, to those who are doing the right thing, thank you. Thank you so much. To those who aren't, this is not too much to ask. It is not too much to ask to make better choices to protect your family and every family. Please make those choices. But let's not have the poor behaviour of some completely undermine the amazing things that our nurses are doing, our contact tracers, our police, those who've come to support us from other states, those who are supporting us in other states from their own state capital, making phone calls, doing all sorts of things, to the people working in that PPE warehouse with millions and millions of items of that very important equipment, to our health heroes who are on the front line, but they're the last line of defence. If you make better choices, then all of us will get through this. This virus doesn't stop. Neither do I, neither does the team I'm honoured and proud to lead. They are all working as hard as they possibly can. Join them in that effort by following these rules. And that's how we'll get to the other side of this.
least 15 nurses from Tasmania have registered interest to come over and help
Yes.
here. How important is that help from interstate, and how do we keep them safe?
Well, look, we've got many different things that have many different. Lots of different help, I should say, has come from other states. Sometimes it's contact tracing that's done from call centres a long way away from Melbourne. Sometimes it's paramedics, nurses, senior public health physicians. There are many people coming from all across the country, and I'm very grateful to each of them, and I've taken the opportunity to thank First Minister colleagues at National Cabinet yesterday and on many other occasions. For instance, I think I reported to you a couple of weekends ago that Premier McGowan, Mark and I had spoken, and they were sending over some people. I'm in constant contact with the Premier of both Tasmania, New South Wales, Queensland, everybody. South Australia sent us some help. Everyone's pitching in, and I'm on behalf of all Victorians, I'm deeply grateful to them. It's a very, very impressive thing. And look, not dissimilar to the way in which we all work together as Aussies, not as individual Victorians or Queenslanders or whatever it might be, every single summer when we face a common challenge and a common enemy. We get through it every summer. Sometimes it's much more difficult than other years. This year was particularly challenging, but that should give people a sense of hope, I think, that we are equal to this task, we are equal to this challenge. We've just all got to play our part. And I'm so proud to think that in my sense of it, and I think this will be borne out by the data, the number of people who are doing the right thing is going up, and that's a deeply impressive thing.
Are we going to be able to have Christmas dinner, Premier?
Someone asked me that the other day. I think that what I want to do is make sure that there are as many people at Christmas dinner as possible. And unless we get these numbers down, we're going to continue to have to be asking families to plan funerals. That's not acceptable. We need to get these numbers down. That part of the year, every part of this year, is going to look different until we get the vaccine. This is going to be part of our lives. It's not about going back to normal. It's about finding a COVID normal. These numbers are too high. We've got to drive them down. The only way to do that is to drive down movement. And that's why I'm so grateful to everybody who is doing the right thing. And to those who aren't, make better choices or you will be fined. It's as simple as that. Any other issues?
What did you make of the umpiring the Essendon match last night?
I didn't get a chance to watch the game, I'm afraid. And I've never been one to comment on umpires in any context. That's enough? You're good?
Thank you.
Very good. I'll see you tomorrow.